Merci, Monsieur le Président.
Thank you, Mr. Speaker. Thank you to my colleague. Today I have the great honor to table this bill for a National Lyme Disease Strategy Act at second reading. It is a great honor because I am certain that since we as members are able to work together, and when that happens, everything is possible.
Great honor of presenting a bill that, in my name, if I could, I'd remove my name and put the names of all of us, because this is a truly nonpartisan effort. And this is reflected in the process of this bill in the House so far. At first reading, back in June of 2012, my seconder was my friend, the honourable member from Etobicoke North, a Liberal member who's been very active on many health issues. And today, the enormous honour of having my bill seconded by the honourable member from Oakville, himself a champion on a number of health issues. I commend him and the Minister of Health, in fact all the Conservative members, for bringing forward C-17, Vanessa's law, and I look forward to seeing that being made into law. These are important steps that prove that individuals can change public policy, as indeed I hope we will hear. By somewhat of a coincidence, the honourable member from Oakville has also taken a stand on the Lyme disease issue, having written a foreword to a Canadian book called Ending Denial, the Lyme Disease Epidemic. The first party to signal full support for my bill in this nonpartisan spirit is the official opposition, the Democratic Party, whose member and health critic, the honourable member for Vancouver East, signaled some time ago that I could count on their support. But I have to say it means a tremendous amount to me personally, and I think to the importance of this bill and the potential of its success is that the honourable member for Edmonton, the Minister of Health, has herself been very willing to work with me. We've sat down and worked over this bill. There are some amendments that I will expect to see in committee, and I don't regard them as in any way other than helpful. I think this bodes well for our ability, working together, to make a difference on this issue. Now, what is this issue? I think everyone in this chamber is now familiar with the fact that Lyme disease is spreading. It is spread through a very specific bacteria that is carried by ticks, often black-legged ticks or deer ticks, but is now spreading to other species of ticks as well. The bacteria Borrelia burgdorferi is a bacteria that brings with it a collection of symptoms that present both a personal potential tragedy and a very troubling set of symptoms for diagnosis. So we've seen as this disease spreads, and it's been spread through ticks can be delivered to other areas through the agency of birds. We also know that the range in which these ticks occur across Canada has been spreading and is part of the increase in vector-borne diseases anticipated in relation to global warming and the climate crisis. So we know that there are more cases. It was certainly, I think, shocking to many when earlier this year, and well actually last year, summer of 2013, the Centers for Disease Control and Prevention in Atlanta, Georgia, issued a revised estimate of Lyme disease in the United States. And their new estimate increased the prevalence of Lyme disease tenfold, reporting that the previous yearly reported cases of 30,000 cases is probably 300,000 cases. This is certainly was a timely reminder to us in Canada as we grapple with this illness that it is indeed spreading and that its incidence is spreading. To the credit of the Canadian Department of Health, since 2009, Lyme disease has been a reportable illness in Canada. There's no question as to the fact that we know it exists in Canada, and health professionals have had a mandatory duty to report when they diagnose Lyme. But we are aware as well that it's now still underreported. The practice and the way the current system works is that any medical practitioner who diagnoses Lyme has a responsibility to inform the provincial health authorities. They in turn report this to the Public Health Agency of Canada. And at this point, we have only 310 reported cases across Canada. Yet I'm sure my colleagues on all sides of the House, just in terms of our own anecdotal experience of constituents who have Lyme disease, of the numbers of petitions that we've received in this place from people urging a solution, urging better treatment and cure, that number is somewhat low. We can't estimate exactly how low, but as in the United States, I think we'll find that as we increase awareness, we'll have a clearer understanding of the incidence. So let me just review quickly what this bill would do. This is, as I've explained, a bill to deal with the threat of Lyme disease, but it does it in a couple of different ways. The bill's goals are to create a national surveillance system dealing with the problem I've just mentioned, that we don't always have good information as to exactly where the ticks are spreading and how prevalent they are. The other areas are important is to get a handle on better awareness, perhaps national standards, or at least a sharing of best practices to understand the challenges of diagnosis and treatment. So the bill calls for, in the language of the bill, l'établissement des lignes directrices.
The establishment of guidelines concerning the prevention, screening, treatment, and management of Lyme disease, which contain, among others, national care guidelines, national care standards that put in place best practices to treat Lyme disease.
It also calls on the Minister of Health, working with others, to create a national program of educational materials to increase public awareness, but also to assist medical professionals. Now, the process by which this would take place is that there is in the bill a mandatory obligation on the Minister of Health, once the bill has come into force, to convene within 6 months a national conference to which the provincial ministers of health would also be involved, and territorial ministers of health, and also the stakeholders described in the bill as representatives of the medical community and patient groups for the purpose of developing this national framework. Now, I'm very heartened that at this relatively early stage in the consideration of Bill C-442, it has already received the support of important elements within that medical community. So I want to cite particularly and thank Eric Mang, the Director of Health Policy and Government Relations for the College of Family Physicians of Canada, who wrote in the fall of 2013 that they support this bill, that, quote, the College of Family Physicians of Canada, quote, supports further studying the economic and health impacts of Lyme disease to ensure that Canadian physicians have the necessary tools and knowledge at their disposal. Guidelines produced as part of the strategy should include the input of family physicians and be available to all primary health care providers. Now, that's the College of Family Physicians of Canada. And even more recently, and I can't tell you how thrilled I was to receive this letter just days ago, February 27th, 2014, from the Canadian Medical Association and its president, Dr. Louis Hugo Francescuti, who wrote the following, and I think it's important, coming from the medical community, that I read some of this letter into our record at second reading debate. Quote, diagnosis of Lyme disease can be difficult because signs and symptoms can be nonspecific and found in other conditions. If Lyme disease is not recognized during the early stages, patients may suffer seriously debilitating disease that may be more difficult to treat. Given the increasing incidence of Lyme disease in Canada, continuing education for health care and public health professionals and a national standard of care can improve identification, treatment, and management of this disease. Greater awareness of where ticks are endemic in Canada, as well as information on the disease and prevention measures, can help Canadians protect themselves from infection. A national Lyme disease strategy that includes representation from the federal, provincial, and territorial governments, the medical and patient communities, can address concerns around research, surveillance, diagnosis, treatment, and management of the disease. In addition, public health prevention measures will advance our current knowledge base and improve the care and treatment of those suffering from Lyme disease. Close quote. So with the support of those two important organizations, associations of medical professionals, the Canadian Medical Association and the College of Family Physicians of Canada. I'm encouraged to know that not only can we work together as members of Parliament from all parties in this place, but I also believe that the approach set out in the bill of a national conference urging people, federal and provincial, jurisdictional responsibility in the health community, as well as the medical community, the doctors, the healthcare professionals, the nurses, people who deal with trying to sort out a diagnosis for Lyme when it's not always easy, and the patient communities, people who have advocated, people who've cried out for help, people for whom this bill represents the first ray of light in what for many has been years of suffering. I'm enormously encouraged by the support from the medical community, and I want to now turn to the support from the patient community, because I would never have even thought to put forward a private member's bill on Lyme disease had I not encountered so many Canadians suffering from the disease. My first friend who told me she had Lyme disease, Brenda Sterling of Pictou County, Nova Scotia, who in her wheelchair told me that this one thing had happened to her, that she'd been bitten by a tick and now she was virtually completely disabled. I was shocked. I didn't know Lyme disease could be so serious when I first met Brenda, but she educated me about it. And then when I moved to Saanich Gulf Islands and living in Sydney, I kept meeting people who were experiencing Lyme disease, some of them kids. I tell you, it's really heartbreaking to know a brilliant young, beautiful young woman, Nicole Bottles, who's in a wheelchair and not able to go to school, not because of the wheelchair as a difficulty, but Lyme disease, as she says, muddles her brain from time to time, and she has trouble concentrating, and she hasn't been able to keep up with her schooling. But she and her mother, Chris Powell, have met many of the people, I think, in this chamber today. They've come to Ottawa and advocated for Bill C-442 because they see it as a way to get to better levels of awareness. I'm so grateful to James, to Michael, other young constituents, to Eric and his family. And when I think about this bill and why I chose it, it was a lot to do with Eric and his family because his father-in-law was such a strong supporter of mine, and I thought, how can I ever thank him? So this is a thank you to Fraser, among many people. But to try to bring forward one bill that could make the difference in thousands of lives. As we work towards this bill, let's keep a couple of things in mind to remain hopeful. One is this: we should never fear the outdoors. I've had some people come to me since this bill was tabled and say, well, for heaven's sakes, be careful that we don't create too much fear of going outside. And I want to emphasize that that's not my intention. I think that I subscribe to the view of some who've described nature deficit disorder as a real threat to our kids. They need to get out and engage with wilderness. They need to be in nature. It increases learning abilities and capabilities and emotional maturity. It's great for kids to spend time outdoors. But just as we've gotten used to the educational challenge of a thinning ozone layer, which, thank goodness, due to the Montreal Protocol, it will not thin more and is reversing the thinning process, but what we've gotten used to over the years, something that didn't occur when I was a kid, which was, what's the UV rating? And wear long sleeve shirts, and remember your sunscreen, and wear a broad brim hat. These are just common sense prevention measures. We need to have that be as common sense and part of our daily routine when our kids go out to play, to say, well, tuck your pant legs into your socks. Yeah, and when they come in from playing outdoors, let me just give you a quick check to make sure you haven't picked up a tick. This kind of thing is a common sense prevention measure. And the really good news about what we're facing with Lyme disease is that it is preventable. That's why a federal framework makes so much sense. If we're aware of the disease and watchful, we won't get it in the first place. Secondly, if we get it, if diagnosis is speedy and correct, treatment works. And the treatment need not take long, and you can recover to complete state of health and well-being. And lastly, the challenge for those who have continuing debilitating symptoms, let's shine a light of hope for them, that with a real focus and continued research, we can find treatment measures that will work for the entire Lyme patient community. I'm indebted to all of the members who've come here this morning for second reading. I thank you for your support, and with your help, this bill will become law. Thank you.
Questions and comments? The Honourable Member for Sault Ste. Marie.
Thank you, Mr. Speaker, and I'd like to thank the member from Saanich Gulf Islands for bringing forward this important piece of legislation. And I would like to thank her on behalf of one of my constituents who suffered for the longest time and suffered in terms of finding a diagnosis and then treatment. And she wasn't able to find appropriate treatment in Canada and actually ended up being treated a couple of times. I think 3 times she went to Mexico. So I'd like to ask the honourable member, in terms of best practices and treatments, is the intent to actually look worldwide and go outside of Canada and the United States to search for the best treatment possible? Thank you, Mr. Speaker.
The Honourable Member for Saanich Gulf Islands.
Thank you, Mr. Speaker, and thank you, my honourable friend from Sault Ste. Marie. I want to make this point really clearly, and this gives me a good opportunity. I'm not a medical doctor. A few of us in this House are, but for the most part, I want to make sure the medical diagnosis and research is left to medical experts, the ministers of health, provincially, federally, and territorially. I would think it makes sense to do what my honourable friend suggests. I know my constituents have gone to the U.S. for treatment, gone to Mexico for treatment. I was interviewed this morning by Kamloops CBC, where a family is trying to raise money for some treatment in Florida that I don't know what it is. I think it's important that what we do as members of Parliament is set up a framework that allows the research to extend to wherever the answers will be found, but that we shouldn't prejudge that. We should make it possible for medical professionals to seek out best practices. I think a lot of those may be in Canada. We just need to share across provincial and territorial boundaries, and perhaps international ones as well. Thank you.
Questions and comments? Honourable Member for Victoria.
Speaker, I'd like to first congratulate and thank my friend and neighbour from Saanich Gulf Islands for her excellent presentation and for her hard work on this bill. During her speech, she alluded to certain amendments that might be brought forward at the committee stage, and I wonder if she could advise this House as to the kind of amendment she would consider acceptable.
The Honourable Member for Saanich Gulf Islands.
Well, I thank my honourable friend and colleague from Victoria for that question. Yeah, and it is helpful to perhaps give a prelude. I don't assume anything. I'm keeping my fingers crossed and toes crossed that we get through second reading and get to committee. I have had the great opportunity of the Minister of Health being forthcoming and sharing with me some of the things that she thinks would make the bill easier from her point of view, and obviously I want to do everything possible to be reasonable and bend over backwards to make sure we can accept any amendments. The kinds of things that have been suggested, I think, are really sensible. I don't want the bill to create, for instance, any federal or provincial jurisdictional conflict. So it's been suggested that we would change the terms around standard of care to best practices, to change the words national strategy to federal framework, and to give the Minister of Health, in the current version of the bill, is a 6 months from when the bill enters into force to hold a conference, but perhaps make that longer to ensure that federal provincial processes are respected. So it could go to perhaps 12 months. None of those things strike me as anything other than helpful, and I certainly look forward to getting the bill to committee so those amendments can be made.
Time for one more short question. The Honourable Member for Winnipeg North.
Thank you, Mr. Speaker, and I'll be very short. And I want to pick up on the point in terms of the need for having that national strategy. As individual provinces, some more than others quite possibly, look at the Lyme disease and what can be done. I just wanted to get the member to maybe provide more comment as to why it's so important that there in fact be a national strategy. This way we can better serve all Canadians through it.
The Honourable Member for Saanich Gulf Islands, short answer, please.
Well, thank you to my colleague from Winnipeg North. I think the reasons are clear in terms of the context. And I have had some honourable colleagues ask me, why should the federal government be involved in this? Partly, unlike other symptoms and other diseases, this one's preventable. Better knowledge and sharing of best practices can allow Canadians, wherever they go across this country, to know again with the metaphor to UV radiation and skin cancer, well, are we in a part of the country where we know that ticks that bear this bacteria are endemic? Are we in a place where we should perhaps be a little bit more vigilant than usual? The more that we share across provincial boundaries, best practices, and then the more that the medical community is able to benefit from what some doctors are doing in one part of Canada is quite different from what's happening elsewhere. Sharing best practices as a country will make sure every Canadian is better protected wherever they live from this terrible disease.